differently. We've been fortunate to welcome many thousands of visitors to our province, some as seasonal residents, some on compassionate grounds, others through family support and family connections, as well as our Atlantic friends and family as part of travel within the Atlantic bubble. People entering our province are screened at the points of entry, and in situations where people did not respect the requirement to self-isolate, they have received a warning or fine. Our ability to contain COVID-19 to date is the result of cooperation and sacrifices of islanders in adhering to the public health measures. And since the pandemic began, we've learned that our individual actions protect ourselves, our families, and our communities, and conversely, the actions of others protect us. The steps that we have taken and the sacrifices of islanders have made a difference in how COVID-19 has affected our province. A sincere thank you to all islanders and visitors for caring for yourselves and one another during this pandemic. However, I would be remiss if I did not share with you my concern for our province as we look ahead to the coming months. It is worrisome to read about the strict measures being put in place, even as far away as Melbourne, Australia, even after they thought they had the virus under control. So no jurisdiction is immune to the resurgence of COVID-19. And we know that large gatherings and the absence of precautions are ideal conditions for the virus to spread. Domestically, in general, we've seen an uptick in cases in the last 3 weeks. We know that we have not seen the end of COVID-19, and there will be more cases in P.E.I. Like the rest of the country, we are anticipating and preparing for a second wave of COVID-19 this fall. But I'm confident in the ability of our health system to respond to this increase in cases of COVID-19. Our collective focus throughout this pandemic will remain consistent: to minimize illness and death resulting from COVID-19, to minimize societal disruption, and to quickly detect and isolate cases of the virus and prevent community transmission. Around the world, there are over 18.3 million cases of COVID-19 and over 694,000 deaths, with a global case fatality rate of 3.8%. And in Canada, there are over 117,000 cases, but 87% of these cases are now recovered, with a case fatality rate of 7.6%. The last week saw an increase in cases in Canada for the third consecutive week, and 62% of domestic cases are in the 20 to 40-year-old age group. In terms of testing, P.E.I. ranks third in Canada per capita at 129 tests per thousand, behind Ontario and Alberta. And the national average for testing is around 111 per thousand population. COVID-19 continues to surge around the world, meaning we are still not past the worst of it. The World Health Organization warns that young people are susceptible to COVID-19 and that one of the challenges is convincing young people of the risk. The World Health Organization has been very blunt in their assessment of this situation, and I quote, "Young people can get infected, young people can die, and young people can transmit COVID-19 to others. So young people must take the same precautions to protect themselves and others as everyone else." The launch of the Government of Canada's Exposure app has been in the news this week. And we'll talk about it more in the weeks ahead, but the launch of the COVID Alert in Ontario provides an opportunity for evaluation and calibration of the app prior to rollout in other provinces and territories. P.E.I. will review the evaluation of the app in Ontario prior to making a final decision on adopting the app here in P.E.I. But a COVID-19 exposure notification app advisory council has been named by the Government of Canada, and P.E.I. will be represented on this advisory group. And this is an important step towards ensuring that the app meets the needs here to safeguard the confidentiality and privacy of islanders while promoting and facilitating appropriate public health action to help stop the spread of COVID-19. The COVID Alert app will provide another layer of protection against COVID-19. It will not replace the important public health measures of physical distancing, hand hygiene, and wearing a mask in indoor spaces. And the COVID Alert app will not replace the need for diligent contact tracing and follow-up of all individuals who are close contacts. And regardless of the COVID Alert app, P.E.I, like other jurisdictions, will continue to focus on timely and thorough contact tracing as the foundation to containing the spread of COVID-19. On July 28th, remdesivir was the first drug given conditional approval by Health Canada for the treatment of COVID-19. This antiviral medication was originally used to treat Ebola and works to inhibit the virus that causes COVID-19. Remdesivir is meant to treat people who are in hospital with the most severe symptoms of COVID-19, including pneumonia. Remdesivir is administered intravenously. As part of the conditional approval, the Government of Canada will conduct ongoing monitoring of the effectiveness and safety of remdesivir. Although the supply of remdesivir is limited in Canada, we have been assured that we will be able to access this drug if needed. More islanders are wearing masks when in indoor spaces, and now is the time when we should all be getting used to wearing a mask in public places. I encourage all islanders to have a supply of non-medical masks or face coverings. As Dr. Strang, my colleague in Nova Scotia, commented last week, when leaving your house, make sure you have your wallet, your keys, hand sanitizer, and a non-medical mask. Masks are one layer of protection. Masks do not replace other public health measures that are really important defenses against this virus, such as physical distancing and good hand hygiene. And masks will likely be part of our lives until there is an effective vaccine for COVID-19. And wearing masks will be important when the prevalence of the virus is even higher in our province. I'd like to clarify the guidance on essential workers who travel to the United States regularly for work purposes. In consideration of the Federal Quarantine Act and the increased cases and risk in the United States, essential workers returning to P.E.I from the States are required to be tested upon arrival in P.E.I, and if negative, they will be able to work isolate. This means they can go to work and otherwise are self-isolating at home. The only exception to this directive is with our truck drivers who are exempt under the Federal Quarantine Act, but they are tested regularly here in P.E.I. Given the epidemiology of COVID-19 in the United States, this approach protects the health and safety of essential workers, their families, and the general public. Learning and childcare facilities across P.E.I have been successful in following operational plans to support 75% capacity. We know that childcare is integral to all aspects of our economy and to the education system. Early learning and childcare centers are planning to return to 100% capacity in September. Centers will be required to have operational plans to continue to ensure minimal interaction between groups of children, cohorting, enhanced screening, and sanitation. The Licensed Child Care Centers directive from the Chief Public Health Office will be updated, and I know there'll be further, more detailed information from the Department of Education or Early Childhood. I know we have talked here previously about the numbers of vehicles that have crossed into P.E.I since the Atlantic bubble. And since July 3rd, a total of 61,430 vehicles have traveled to P.E.I, 53,200 of those at the bridge, the remaining at the ferry. And the long weekend, this past weekend was a very busy one at our points of entry. On Friday, July 31st, over 3,700 vehicles were screened as they entered P.E.I via the Confederation Bridge. And this was a record day in terms of traffic, even when compared to the first day of the bubble. Staff screened all 3,700 vehicles and the 8,600 occupants. I would like to thank Pat Dowling and the team at Borden for their incredible work and commitment to protecting the health and safety of Islanders every day. The team is comprised of environmental health officers, highway safety staff, casuals, and a wonderful group of post-secondary students. And we also have assistance from enforcement. Thank you all. Since the Family Connection stream was launched last week, we have received 222 applications. And to note, we've had 389 individuals who have been denied entry to P.E.I. when they've turned up at the points of entry. In terms of testing, since the pandemic began, we now have tested over 20,530 people here on Prince Edward Island, and that includes 1,370 in the last week. So in closing, I encourage Islanders to continue to pay attention to the basics. It's not the time to become complacent. We do not want to give COVID an opportunity to make a big surge back in P.E.I. Yesterday, I was reminded of a phrase we spoke about earlier in the pandemic, that Islanders can come together by staying apart. And when we think about maintaining physical distance, I think it's that advice is still really relevant. But it's also about good hand hygiene and keeping our circle of contacts small and wearing a non-medical mask when enclosed indoor spaces. And these can be really good defenses against COVID-19. As I noted at the outset, we have much for which to be grateful. And sometimes I need to remind myself as well to have that attitude of gratitude. I am grateful for being in Prince Edward Island, and I'm grateful to be surrounded by wonderful, caring people in our province. And I'm grateful for having the privilege to help protect the health of Islanders. So let us continue to look out for one another. Let us be compassionate to yourselves and others, and let us be patient, and let us be kind. Thank you. And I'll open it up for questions.
Steve Stewart, The Guardian.
Good morning, Dr. Morrison. I guess one of the questions I want to ask is in terms of the Canadian Premier League players that are heading our way shortly. Just wondering how players are self-isolating, and I ask that because people have been distributing photos on social media, I guess primarily Instagram, of players seen outside and enjoying everyday life. So I guess just a reiteration of our players self-isolating.
Hi, Dave. So my understanding from the league, and I'll be following up certainly with tourism officials here. I was reassured and assured multiple times that these players are in self-isolation prior to arrival in Prince Edward Island, and then of course will be in their own bubble for the 55 days that they are here, with increased testing as well. So I think that's really important, and it's a requirement that we have. So if that's not the case, we will be following up.
Thank you. And I guess a follow-up would be in terms of who's going to be arriving. Do we know how many are coming to Charlottetown, not just players, but sports broadcasters, play-by-play people, what the sort of the total is?
Yes, there are approximately 240 players, and then with all staff, coaching staff, as you mentioned, broadcaster, they would be a total of up to 300. And of course, we're trying to manage the risk, and of course the real good plans being put in place to try to protect the players, the staff, as well as the public here in Prince Edward Island. And we anticipate, of course, international students arriving, and those plans will be in place as well, and we'll be talking about those in more detail in the coming days and weeks, because there'll be a number of hundred of international students coming in that we also need to make sure that they're self-isolating and protecting, are safe themselves, and also make sure that the Islanders are safe. So it's trying to manage many of these different plans and knowing that we have people coming into the province. As I mentioned, thousands of other people coming into the province, and to date we've been trying to manage that as carefully, cautiously as we can.
Thank you very much.
You're welcome, Dave.
Stephanie Van Kampen, CBC.
Good morning, Dr. Morrison. You mentioned other regions are preparing for a second wave. What is public health doing to prepare for a second wave?
Hi, Stephanie. So, as you noted, we are in ongoing conversations with Special Advisory Committee and our Technical Advisory Committee nationally about what the epidemiology could look like, what's going on internationally as well in terms of the cases. And I think we've had a chance provincially to make sure that certain things are in place before a second wave is anticipated here. One, the health system has itself responded and they know they can be prepared for an increase in cases in our facilities. We have learned about the testing. I mean, we started unable to do any testing here in Prince Edward Island, and now we're able to do an incredible number of tests here on a weekly basis. So we are preparing from a testing capacity point of view as well. And with all our, with every case and with every experience that we've had, even the cluster of cases last month, we're learning and making sure that if we need to update guidance documents, that's being put in place. And in some ways, this has allowed us some time to make sure that some of the fundamentals are in place and that we continue to learn, and we may have to make some modifications in the weeks ahead, of course, but we're going to be as ready, a lot more ready for the fall than we would have been in March.
And just to follow up, I know tomorrow we'll be hearing more about plans for going back to school, but thinking of that in conjunction with anticipating a second wave, what are your concerns and your priorities when you think about the plan for sending children back to school?
Well, I think as a parent, I share that that feeling. We want to get our children back to school. We want to do it in a safe way, and I know the department will be sharing the details of that plan. But I think it's some of the measures that they'll talk about tomorrow are to minimize the impact, so that if there was a case identified at the school, it could minimize the impact of the functioning of the school and the impact of the health of the staff and the students. So those are the things that we keep in mind as we go into the fall, and with the anticipation of some more cases. And I know we've had conversations with education that if the epidemiology changes, we look at what the triggers will be about moving from one plan to another plan. And I think that'll be key as we go forward, and we'll have to adjust based on what we're seeing in our community.
Thank you.
Laurent Rigaud, La Voix acadienne.
Bonjour, docteur Morrison. J'avais une question en français sur ce que vous avez dit au sujet de l'application Alerte Covid qui a été lancée en Ontario. Est-ce que vous pouvez juste nous réexpliquer en français si cette application va être disponible à l'île du Prince-Édouard?
Bonjour. Alors, l'application, ça commence, c'est pour le Canada, mais ça commence en Ontario. Et puis, on travaille avec un groupe pour regarder comment ça va marcher ici à l'île du Prince-Édouard. Alors, à un moment donné, ça va être disponible ici, mais c'est pas encore prêt. Mais j'imagine que ça va être prêt avant le fin de septembre. C'est peut-être même avant ça, mais c'est ce que je pense à ce moment.
D'accord. Et donc, dans l'optique d'une... d'une seconde vague, la préparation pour une seconde vague. Cette application, ce sera un outil essentiel pour prévenir la seconde vague. Est-ce qu'il faut continuer à porter le masque? Est-ce que vous pouvez nous réexpliquer ce que les insulaires doivent faire pour éviter une seconde vague en français, s'il vous plaît?
C'est pour éviter une seconde vague, c'est pas seulement l'application, c'est juste une autre chose pour nous aider, mais les choses qui vont diminuer le risque d'une deuxième vague, garder la distance physique, c'est les choses qu'on parle toujours, mais la distance physique, laver les mains, n'allez pas à l'école ou au travail si vous êtes sentez malade. Et puis les masques, vous devez les porter quand vous soyez en dedans. C'est des choses comme ça. Si on continue d'en faire, ça peut peut-être diminuer le risque d'une deuxième vague.
Merci.
OK, merci.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Je me demandais, dans la perspective d'une deuxième vague, si on admet que c'est inévitable qu'il va y en avoir une deuxième, qu'il y aura d'autres cas à l'île, qu'est-ce que vous avez en votre possession? Qu'est-ce que vous savez maintenant que vous ne saviez pas au mois de mars lors de la première vague qui pourrait faire en sorte que dans le cadre de cette deuxième vague, on ne soit pas obligé de tout fermer les commerces, de tout fermer l'économie pour passer à travers? Qu'est-ce que vous avez dans vos plans pour faire face à une deuxième vague sans qu'il y ait les conséquences qu'on a connues au cours de la première vague?
C'est une bonne question. On sait maintenant, plus qu'en mars, que c'est les résidences long terme qui ont vraiment risque. Et puis c'est là où la plupart les cas, les personnes qui sont mortes sont dans sont des places de résidence long terme. Alors, on sait les mesures qu'on peut mettre en place tellement vite pour en protéger ces gens. Et on est plus près avec, on sait plus maintenant à propos de l'équipement protectif personnel et on en a assez. Alors, je pense que on sait que c'est important. On a aussi l'habilité maintenant de faire de plus en plus les tests ici à l'île du Prince-Édouard pour qu'on peut voir la transmission. Alors, c'est vraiment, on a pris tellement de choses, même on n'a pas peut-être besoin de même montant de ventilateurs qu'on a pensé, parce que la plupart des cas, même s'ils sont à l'hôpital, n'ont pas besoin d'un ventilateur. Alors, c'est vraiment de toutes les façons qu'on est bien plus préparé à avoir une réponse ou un peu réagir en cet automne qu'en mars. Et puis, c'est pas seulement ici à l'île du Prince-Édouard, mais partout au pays.
Et aussi en français, est-ce que vous pourriez me rappeler le nombre de véhicules qui sont entrés à l'île du Prince-Édouard depuis l'ouverture de la bulle atlantique? Vous avez parlé de 61 000 véhicules. Pourriez-vous répéter ces données-là en français, s'il vous plaît?
Depuis le 3 juillet, on a 430 véhicules qui sont arrivés à l'île du Prince-Édouard, 53 000 au pont et 8 200 au traversier Wood Islands. Et c'est à peu près 134 000 individus qui ont voyagé à l'île depuis la boule.
Merci beaucoup.
Louise Martin, CBC.
Oh, hi there. Good morning. Still morning, I guess, before noon. Just wondering about, we're doing a story on returning to school for post-secondary students as well, Dr. Morrison. So I'm just wondering what the process is for beyond the bubble Canadian students who are planning on coming to P.E.I. for, for university or college.
Hi, Louise. So I mentioned the international students, but that we're working presently with primarily the university and Holland College about the return of the international students, but also of the domestic students outside the bubble, and also working with the Office of Public Safety, of course, for some of that pre-approval travel that has to happen. At this point, of course, there would be self-isolation plans required for returning domestic students outside the bubble as well as the international students. So we are currently reviewing those plans and working with the university and Holland College.
Okay, great. Thank you. And I just wondered too, another story we're working on today, is there any specific public health advice on P.E.I. around safer drug use and safer sex during the pandemic?
I mean, I think in terms of the messages from a public health point of view, whether it's pre-COVID or during COVID, some of those messages would be very consistent about making sure if you're using drugs, that you know your supplier, that you're making sure you have naloxone kits available. You don't use alone. And so some of those messages, I know we've talked about them here before, Louise, they would apply and are really important regardless of COVID. The same would apply in terms of our messaging around safer sex practices and of course, you know, we want people to be safe, and from a public health point of view, those messages are consistent throughout and regardless of COVID-19. The question is a good one because we don't want to forget about those other really important parts of public health that are going and are continuing to be issues, and we recognize that even during COVID.
Okay, appreciate it. Thank you so much.
Thank you very much.